Recording is on.
Thank you so much for everyone who made it to the discussion today, to our webinar today. This is Ambucycle's first webinar. For a brief introduction of Ambucycle, Ambucycle is a emergency health tech company that is based in Rwanda. What we try to do is decrease emergency response times. One of our novel products to decrease emergency response time is our Ambucycle. In the Ambucycle, we send healthcare providers on motorcycles to accident sites using uh, apps to locate patients and nearby providers. We also give first aid trainings and self first aid kit in order to decrease emergency response time and make emergency care accessible for everyone because every second matters. Um, we want to start webinars specifically on emergency care and making emergency care accessible in every setup. And this is the first of our webinars. My name is Dr. Loza. I will let Dr. Helen also introduce herself.
Thank you, Lozaye, and thank you everyone again for showing up and for trying to participate in this important discussion. My name is Dr. Helen, and I am the co-founder of Ambucycle. As Loza described, this is the first of our mini webinars, and we're going to be talking about emergency preparedness and the importance of emergency medicine in different scenarios. We're starting with workplaces, so thank you for coming, and I'll leave the first of the presentation for Loza to start the discussion. Yes.
Thank you so much. So, in order to start the discussion, the first next slide. The title of this discussion, as I said, is workplace safety and emergency preparedness. And the outline of this discussion looks like we're going to outline our objectives and then discuss why emergency preparedness in workplace matters, followed by discussing what emergency action plan, and we're going to be discussing different scenarios where emergency preparedness and workplace safety play an important role. So, but before we start the discussion, we have a pre-webinar question, which is you found your colleague unconscious when you came back after a lunch break. What are the first two things you would do? And you can share, you can write in the chat box what you would do. I'll give you 1 minute to do that.
We can proceed and ask this question after the webinar to see, like, for you to compare your answers pre and post this webinar.
Yeah, okay. So the first question where people always ask when we talk about emergency preparedness and workplace safety is why emergency preparedness matters or why it is important. The reason why emergency preparedness matters is because emergencies will happen. So if we try to discuss some of the numbers that are associated with workplace safety and emergency preparedness, um, there are around 350,000 cases that happen only from workplace accidents. So this is excluding occupational hazards or like disease that might result from where a workplace that is unsafe for everyone, but solely accidents. So there are 350,000 deaths from workplace accidents and 270 million injuries worldwide happen because of workplace accidents. This excludes like road traffic accidents that happen during commuting to work or other things, but then specifically solely from workplace accidents. And there are 270 million injuries, and we counted during this. This is only counting our injuries that made uh, uh, workers leave a leave of absence for about 3 days, and we're not counting minor injuries that are like cuts and abrasions and things like that. So among the many accidents that happened, the men is comprised by the construction industry. There are around 60,000 accidents that happen only in construction sites among the 350,000. accidents that happen annually. Okay, so the first thing that we ask from workplaces to have is an emergency action plan. Emergency action plan in some setups is a document, and in some others it's just an image guide that is plastered in places very visible for everyone. So what the emergency action plan has is a specific plan for actions during emergency. So what should people do in during emergency settings? So the first one, it can include anything based on what the workplace requires, based on the need of the workplace, and based on the previous experience of the workplace. But it should at least include emergency numbers, which are different from every site, every city, which is different for fire accidents, it's different for medical emergencies, and it's different for other emergencies like violence at workplace. So there should be emergency numbers that are available for everyone in a language that people do understand. The other one is that it should be including the location of kits and extinguishers. So we're assuming that every workplace. While we're saying this, we're assuming that every workplace has first aid kits and fire extinguishers that are put in the building. So the location of kits and the location of extinguishers should be specifically written in there, and the evacuation zoning plan should also be written in the image guide, in the emergency action plan, which might be an image guide or a document that is available for everyone. Uh, so when we talk about for workplace safety, um, can I have the next slide, please? We should remember that every workplace has a unique need. So like in this image, we can see that there are four workplaces. There in one there is a cafe, there's a construction site, there is a mining site, and there are schools. So we can think about things that these four workplaces need. And for example, the first one is a cafe. So the accidents that can happen in cafe are very different from accidents that happen in mining sites. So in cafe we can have maybe a hot water spillage. So we might have burn that results from that comes from a scald. We might have fire, of course. We might have medical emergencies. But then when we come to construction sites, we might have falls. We might have injuries from big machines that are being operated. In mining sites, this is also entirely different because the accidents uh, in mining sites are different because they work, as we can see in the picture, they work in a completely different setup. So accidents that happen there should be handled entirely differently, and the numbers that we call are also entirely different because of their location and because of the the accidents that can happen there. For example, we should also consider chemical accidents, chemical emergencies in mining sites as well. When we come to schools, schools are also really different from other workplaces. Like in schools we might have students, like young kids that suffer from medical emergencies. We might have violence, we might have fall down accidents, we might also have other medical emergencies that happen to kids. So all these things should be considered. So while preparing workplace emergency plans, and while preparing for workplace emergency, all these things should be put into place. Yeah.
Thank you very much, Luzaye. I am going to proceed with the rest of the presentation. If anybody wants to discuss other things here as well, I'll give you the minutes. You can just raise your hands. So before we proceed to the next part of the discussion,
Your workplace
I'll
has
use something that is a little bit funny, but it's not really actually funny.
your workplace has no first aid kit or emergency plan or a drill. In case of an emergency, your employer expects you to man up. In case of an accident at work, the plan your employer has is to know what God is doing in your life.
Now this looks like it's a little bit funny, but it's actually very serious. It's up to like employers to actually have a plan on what to do during an emergency, especially when most of the works are field related or any accidents can happen, even in the office, even at a workspace, where there are like lots of people. People already have some type of coexisting diseases with them. Sometimes it's just an accident, It's mining, it's construction, it's like you can see maybe a garage, anything really that involves machines or even just small things will lead to an accident, and it's up to us to make our workplaces safe. The thing is, like, now most of the times we currently spend more time at work than at home, so it's only fair that emergency preparedness should be set up at work for us to have a safe life and to do what we can do. But anyway, even if your workplace does not have a safety plan, we're going to be discussing on what, as an individual, a person can do. It's not going to be a whole first aid training, but it's going to be something to just equip everyone before leaving this webinar with a thought and also with an interest to actually embark on first aid trainings. They're almost always available around you, whether your approach you want it to be online or offline. There usually are like first aid training. So this is just to pique an interest within you as an individual. So what you should know first thing is whenever an emergency happens, you should always imagine the worst, and you should always know that something big, more than what you can accomplish, is happening. So it's not a time to be brave. Of course, you should be brave, but also like you should also always put yourself first. That's the first rule of an emergency. So we always teach people to check their environments for hazards, for toxic gas, for gunshots, for any type of like unstable equipment or what caused the accident. We should be curious. So whenever you're walking into an accident, maybe somebody's bleeding, maybe somebody's lying unconscious, like in the first question, in the pre-webinar question, somebody's lying unconscious, so we don't know like what happened. Maybe there is a gas leak and somebody went unconscious because of that certain gas leak, and if you go into the room, maybe you will also be unconscious. So it's always fair to assess with all of like your senses what's going on before entering something. Usually what happens is like people will go into a bomb explosion, and then the second explosion usually happens then when it's a terrorist attack or something. So it's always fair for you to stand and to understand what's going on. So we always say check scene safety first. And the other thing that you should do before embarking on any type of help is to call for more help. This could be by shouting, by alerting everyone in the building. It could be a building, it could be a site, or by pulling out a phone and calling 911 or whatever the number is. Like, for example, in Rwanda, it's 912, and maybe in Ethiopia, I think it's 991. But like in every country that we're in, it's up to us to memorize the emergency numbers, and it's up to our coworkers or our family members to memorize that exact number for us, so that we can be safe as well. And as Loza said, companies should make it a tradition to have these posters everywhere that shows an emergency action plan with an emergency number, with what to do during an emergency, so that people can just quickly reference, because in a time of panic, certain things also like disappear. So this is for the employers or for people who are working in HR or in other managerial positions to actually put a number there. So always remember to call for help and to check for scene safety before doing anything. So after this, we're just going to go case scenario after case scenario. We're going to be seeing a little bit of like something that things that are quite common. We won't be able to cover everything here, but we can just start the discussion. So we gave our cases a name, an age, just so that they can be real, and then you can actually imagine someone as you want within your workplace. But let's see Joshua. So Joshua is a 47-year-old colleague of yours whom you found lying on the ground when you came back to the office. He was alone and there were no signs of an unsafe scene, and you shouted for help. So what do you do next? So this leads us back to the pre-webinar question. So what do we do when a person lies unconscious and we find them? If anybody wants to actually talk, then we can. Instead of it being a lecture, we'd appreciate that. You can raise your hands, but if not, we can just go and pause it. I'll give you, let's say, 30 seconds. I don't have actually um, the patience like Loza to give you a minute, but I'll give 30 seconds. So when a person is lying unconscious, what are the first things that you think of, or have you ever encountered this problem? It's quite common for people to be unresponsive. At least let's put the word unconscious, but let's just say unresponsive. Okay, so let's proceed. So a person can be unconscious for so many reasons. These are reasons that we cannot even like finish listing. Depends on whether Joshua has something that you know of. Did Joshua sees before being unconscious? Many things actually. But the basics always stay the same, and they're called the ABCs. So these are the critical things that determine a person's aliveness, or a person's life, or the fact that they survived this accident, or this thing that they are facing. So we should always like keep it to the APCs of life. So the APCs of life, as we say, are the basics, and they are called the airway, breathing, and the circulation. So the airway is the thing that lets the air inside of the body. It's like the track, the mechanical track that is the nose, the mouth, and also like the tube that takes the air to the lungs. So if there's any type of obstruction there, if there's any type of like blockage or any type of narrowing that prevents the air from entering, that means the person is not breathing. If the person is not breathing, that means the person is will be unconscious for a very long time, which will lead to brain death, and then again lack of oxygen, and then brain death, and then other complications. So the first thing that we need to check the A always is like, is the airway open, or is the airway can it let an air in? How do we check that? We can always like see the mouth of the patient. We can always like see the nose, the mouth. Sometimes it could be like a child, but in this case, let's just imagine Joshua. But we have to check if the airway is intact. And if the airway is intact, we should always see the breathing. So breathing is like, if the airway is open, we will always hear the breathing sound, or we can see the chest movement of the patient. So as we approach the patient, now we already know that he's unconscious. We were calling for him and he didn't respond, so we shouted for help. The scene is safe, so now we're proceeding to actually touch the patient. So we now see him, and then we were like listening to his breathing, and we can't hear anything, and then we don't see the chest rise up or down, just how a normal breathing person do. So what are we going to do? We're going to check for the pulse now. So we will check the pulse, and then nothing is going on. So now we proceed to the APCs of like, we proceed to the present, I mean to the intervention part of the process. So usually for airway, what we should do is like put the patient in a position that can lift the airway, or that can open the airway, which is usually what we call a chin lift position, that we actually like tilt the patient's head and actually open the airway for them. Sometimes we have to do a jaw thrust, but that's usually doesn't come without practice, so we will need like a physical practice for that. But the thing we can do is just raise their head, tilt their head downwards, and then raise the chin so that they can have like an open airway. The other thing is to check for, like I said, so the person was not breathing, and then there is no pulse as well. Then the next thing to do would be to do the CPR. So CPR is where we do a cardiopulmonary resuscitation. If possible, earlier before COVID eras, the protocol was to give 30 compressions, as you see in the picture here. You should lie down on a flat ground, and you should start the CPR as soon as possible, but you have to make sure that there is no pulse. So if there is no pulse, you put them like this, and then you straighten your hands, and you make strong compressions, 30 compressions, and then take two breath, I mean, give them two breaths, and then continue the compressions until you feel the pulse. So this is how you were supposed to do it. But now the breaths uh, are not part of the protocol because of like the diseases, the airborne diseases that we encountered over the years. So now what's expected of the protocol is to give the compressions. There are many ways of giving such CPRs, but it's always good to give strong CPRs with 5 centimeter depth. And as I've said, it's very difficult without the demonstration. I have prepared a video to show you at the end of the seminar or this webinar. So we'll see it then. But what is the definition of a good CPR? We shall see after the end of this seminar. But it's good to remember this is not the time to give the CPR. If a patient is unconscious, he's not breathing, and then is pulseless, it's like the sign to just start the CPR, and then keep on giving it until we hear the pulse. This is, of course, after calling for help, which help will arrive until you are doing this. It's also better to be with a group of people so that you can take turns. This thing is a very tiring activity, and we shall not give up on the patient while we're trying. The other case scenario is a person called Hannah. So Hannah was, let's say, a designer, and she was using a cutting machine for her designs, and she was cutting her garments, and unfortunately, she cuts her arm, and it's now bleeding profusely. So you see her, you turn around, and this person is bleeding. So what do you do when a person bleeds? That's also another question. So this also puts us back to the ABCs again. And from the APCs now, because it's bleeding, we shall focus on the circulation. Circulation contains bleeding. So what it means is, like, if a person keeps on bleeding, especially if it's profuse type of bleeding, what's going to happen is they're going to lose a lot of blood, and because of this losing of a lot of blood, they're going to turn unconscious, and then they're going to stop. They're going to have a low pulse, which eventually will stop. And then if it reaches that stage, then you'll have to activate again the CPR process, the cardiopulmonary resuscitation. But for now, because they are already like in the process of losing blood, and they have not yet gone unconscious, what do you do for them? So when a person is bleeding, again, you should always cover yourself before any contact with any type of body fluids. So the first thing that you need to do is put on gloves, or put on like a protective plastic, whatever you can find, but never a direct contact with blood or with any other body fluid. The first step of giving first aid is making sure you are safe, like we said. You have to be wearing your protective gears, whatever you can find. This is also one of the benefits of having a first aid kit in the office, which usually will contain gloves and also like personal protective devices for yourself that you can wear and protect yourself. So one thing that you can do, if it's like a bleeding that you can stop, then is like compressing it. So giving a high pressure compression to a bleeding site will help the bleeding to stop. Whatever, like wherever the bleeding is coming from, you should always start the compressions first. If the patient can't compress it themselves, then they can compress it while you do a tourniquet, where you tie just a little bit above from the bleeding site, and then you stop the source of the bleeding just from the source, and then it will eventually die down. But if you cannot even do that, the compression will just be enough until help arrives. So as any case, like, you should always shout for help, and you should always like activate an emergency response by calling the your emergency number, calling or shouting for help, and asking other people to call for you is also like the same. And then you should always attend attend bleeding in such a way that you either compress it, and also it's also like, and tourniquet if it's like, especially an arterial bleeding, something that we call like very profuse, and it's pulsating and it just doesn't seem to stop, and it's like a pool of blood. Then you should always tourniquet, and you should always keep on compressing and compressing. If it's a deep wound, then you should always like pack it with sterile gauze, which also is like something that should be available within your first aid kit. Like I said, it's always good to check if your kit, on the normal days, you should always check if your kit already consists of these things, or if it needs a review or something. The third case scenario that we would like to discuss is burn, but it's not like the regular burn. So let's say your coworker forgets to put on the chemical resistant gloves or face shields, and a sudden splash or back spray hits his bare skin. So we're going to be talking about a chemical burn. So burn, there are different types of burn. There is an electrical burn, there is a heat burn that we see mostly, and then there is a chemical burn that is usually very much apparent in industrial areas where they use a lot of chemicals. Maybe it's an acid, maybe it's an alkaline, maybe it's something else, but chemical burns do often occur. So what is the first thing that you will do? Again, I'll leave it to the room. Okay, so the first thing that you need to do again is check for scene safety. So what do we mean by check for scene safety? Maybe the chemical splash has splashed all over the floor or something, wherever like you touch, then you're going to be burnt next. Because such chemicals, especially some of the dangerous one, will even pass the normal like clothing garments and will burn your skin. So you should always make sure that the scene is safe. Always. The other thing is you should always put on your personal protective devices so that you do not come in direct contact with the chemical and then also like be another patient. So the first thing that you need to do is wear these things and wear the chemical resistant gloves or whatever, and then start rinsing the person with water. Sometimes such companies will have like the antidote, or how do I put it, the the treatments that you need to spray on these people, or like whenever these accidents will happen, sometimes they will have it. But usually what will happen, or like from what we've seen, what's important is to put on water on these patients, not ice cold, not hot, but to put on water and to make sure that it's washed thoroughly before the patient develops something else, but to immediately alert emergency and then to take them to the hospital or for the hospital to come and get them, because chemical burns do progress really really fast sometimes, and it needs to be stopped. There are times where I haven't written the scenarios, but there are times where people deal with snake bites. People deal with some things that are very much unusual, um, or maybe usual, even like electrical burns. There is a lot of times where workers are like working with fixing some electric line, and then that line falls, and then the person has now an electrical burn injury, and then they're also like transmitting the current, and then people come touch them and then they die. I mean, they're also like the next victim of the electrical burn. So it's always important to just be aware of our environment, and it's one of like it should be a very much part of even like the curriculum where we teach our kids at school, to just kind of be well equipped on how to deal with like such life emergencies. They happen everywhere, they happen at home, and they especially happen at work. If you remember recently, there was something that I read in the news, that is where a worker cut his arm off while doing something with a machine, and his other coworkers, when they took him to the hospital, also they took the limb with him. So now the doctors were able to reconstruct the limb, and the limb became functional again. This type of knowledge comes from knowing that you should take the limb and then maybe like they can do something with it. um, these are the things that we want our like coworkers and people working in different industries to be aware of. And then again, as an employer, or as someone who is owning these companies, these industries, we should be responsible enough to make sure that the workers are safe, and they know what to do during an emergency, and we know what to do during an emergency, and we prepare the right kits for them, refill for them, make sure that we are connected to the right emergency response for them to get to the hospital safely, and to make sure that they're always okay. And this kind of concludes our points. So if anyone wants to discuss or even say anything, yeah, before I forget, yeah, this was for the chemical burn and other types of burn as well. So after rinsing them, you should always remove jewelries or other things that's like on them, and make sure like they're well exposed to see if there are other injuries, but also like to make sure the chemical is safely like out of the way. Thank you very much for attending this webinar, and yeah, let's see if anybody has questions or discussions, and we can also like discuss the pre-webinar question on like what you will do if you find someone unconscious in your workplace.
I think I think it has been answered in the discussion as well. But
Yeah.
we have consequent sessions on first aid and how to um, make emergency care accessible even before professional care arrives by using first aid training and first aid kits and just responsibility and vigilance in workplaces. But thank you very much for the first conversation that we had.
Yes. Um, so I said I'll share the CPR video, and while we're watching that, we'd like to invite everyone to follow our pages and then come to the next webinar as well as we discuss other topics and emergency in other settings other than like the workplace. Emergencies may be more or less similar, honestly, but um, they still are like different in different scenarios, and they also like include what you will do and what type of kits that you will get, honestly. So this is the chest compression and this is the position. As I've said, it's
One hand in
very
the center of the
important
chest over the
to
lower
do
half
it
of the
right.
breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with a beat between 100 and 120 per minute. The Bee Gees song Stayin' Alive has a great name and is the correct rate for performing chest compressions. The American Heart Association website provides titles of additional songs that can help you give
So as we get
compressions
back,
at the correct rate. Finally, you need to allow the
yeah, that was all about the chest compressions. Yeah, and as the in the video, it's from the American Heart Association. She was discussing the songs that are now added. I've heard like Kendrick Lamar's song, not like has been added to the ones that you can use to get the best written for CPR and whatever. Like I think you can use anything, but do the CPR nonetheless. Yeah, if there's anything that you'd like to add, Lozaye, before we conclude and wrap this up.
No, there's nothing. I think both as employees, we should demand workplace safety, and as employers, we should also have responsibility of ensuring workplace safety. Yeah, thank you so much.
Thank you so much for coming. We will make this a thing, and then we're going to be coming with lots of webinars. We haven't decided on the weekly or bi-weekly thing, but we will do it nonetheless. And then you'll see more of us. Thank you very much for coming. We appreciate it. And have a great evening ahead. The rest of the evening, I meant. Bye.
Bye.
Who clapped?